We're at
What are you
quarter
playing?
two. So here's the here's, like I said, here's the event page. It's on Confluence. If you search for Implementation-A-Thon, you can get to it, Implementation-A-Thons, and then we have all of the events, all of the minutes from all the previous one. So please do go take a look. Make sure that if it was your topic that we got, Jigginder takes great notes, but just in case there's something missing. We do have a couple issues that we're going to be taking forward that are listed at the bottom. There's nothing I think that we need to necessarily go over right now. But yeah, please take a look at that. I do want to talk, fill out the event survey. We do have a plan for the next IAT in July. And so, all of the feedback that we get from the survey does, we take that into account. And I did want to talk a little bit about, we do have a dashboard. As the C-CDA management group has a project dashboard, and one of them is around the community building and the IAT support. So, you can see here, we do have a list of the issues. So all of the issues, all of the action items that we've had from prior implementation-a-thons. So the link that's here, that's on the page, takes you to the list of those action items, and we've got this sort of dashboard about it. Right, and it shows in total we've had, since we've started been tracking these, 19 issues, of which 7 are completed, yay, and 11 are in process. We still have 1 open, and so the C-CDA management group does take seriously what happens at these implementation-a-thons, and and tries to make sure that the issues we raise, the action items we raise, are actually progressing and going forward. So this link's in the slide deck that we'll send out to everybody. So that's quite important. Other than that, like I said, this is an open slot here. So does anyone have any issues or anything like that they'd like to bring up? And again, Rochelle, for those of you who are new time comers, Rochelle had a great idea. If you want to speak up and let us know, what you thought. Obviously, we have a podcast request. We're gonna have to get down and start doing a CDA podcast or something. But seriously, if anyone has any, if you came and were expecting X and we didn't give that to you, again, if you can fill out the survey. But if you want to bring it up here, or if you want to tell us, how great Lisa Nelson's segues back into CDA were, that's always good, something you can do, and let us know now. So I open the floor up to anyone who wants to go. It is the end of the day, so I recognize that people might be tired.
I think I thought to hear me talk, but I'm gonna say one thing really fast. Lisa's human to machine readable formula in all 3 sets of its series, I really enjoyed that. I think that was something was really cool about that.
Yes. That was new too, something new that we did. So it definitely worked well, I think. Got some attention.
Yeah, I did like that. Although, like I think I mentioned at the time, I was getting the whole Terminator vibe. Don't tell, make sure you tell humans more than you tell the machines, because they could rise up against us. But
how many newcomers did we have this meeting? Do we have a stat on that?
That's a good question. I don't know. Do we have Dave? He might not be around. Dave Hamill. Do we know how many first timers?
Maybe people could raise their hand in the chat. In the participant list, raise your hand if this is a first IAT.
Yeah, you could do that. So if you go to the participants and raise your hand.
We won't absolutely call on you, so don't be shy. Oh no, Sean
like, I made it through the whole day without having to be spotted. Exactly. Now they're asking.
We got 2 people raising their hands. Sure, there's a few more. 3.
Awesome.
Oh yeah, Nancy. Yeah, that is true. That is. I feel like over the past months we've gotten to know you. It's like you're a regular, but you're right. This is your first. All right. Well, that's nice.
I'm going to take that as a compliment.
You should. Yes.
Thank you.
It was one of those. Oh, Nancy. Yeah. Right.
Jean, one of the things that I'm curious about, especially because we're trying to take this use case for the closed loop referral and really work it over the coming 2 years at Direct Trust, at the IHE Connectathons again. I was surprised there really only 3 EHRs were at the IHE Connectathon demonstrating this referral pattern. And I'm just wondering what other implementers like Allscripts and Cerner and other information exchange partners who are involved in referring and responding to referrals, what they're doing in this space, and what could we do to make this testing more appealing and more relevant so more people will come and learn how to do this. I know, Emma, you speak for Allscripts. David Riddle is online with Cerner. If you're not doing 360X, what kind of support is planned for a closed loop referral type of exchange pattern?
Imagine Commonwealth and Care Quality is involved there, right?
Lisa, this is Dee Dee. I have a, I have a thought. I think the 360, I think it should be something that we look at and definitely do again. Have you given any thought to maybe changing it? Because you had a diabetic patient, which is wonderful because you can bring in so many specialists. So I completely get that. And it is universal and it's care coordination everyone needs. But with COVID being what everybody's really focused on these days, have you thought about something like care coordination with COVID for like a long hauler type of patient or something like that, that will grab when they get vaccines, when they, things like that, because there's coordination for that as well needed. And you might reinvigorate it because it's something different that people are focused on, even though it's the same type of testing, the same type of specifications, it's just a different disease state. It's a different.
Dee Dee, this is Dr. Miller. Actually, the HIMSS Interoperability Showcase will be featuring 360X with a COVID patient and 8 different vendors. So I think that
There you go.
And it's also been, I should also mention that for years there has been a demo of 360X in the Interoperability Showcase, I think for the last 3 years.
Yeah, I think that's it. It's just not the new latest greatest. That's why you may not have had as many vendors because they've already.
Well, it's like every year about 8 vendors have participated. So, and I think, Lisa, there were multiple vendors that ECW and Epic both participated in the Connectathon to demonstrate 360X this year as well.
Only 3: Next Gen, ECW, and Meditech. Epic. No, Epic. Well. Epic. Next Gen, not ECW. Epic.
Well,
Next Gen.
ECW in the chat said that they did participate.
Yeah, ECW definitely participated. Epic definitely participated, and in fact, Epic and ECW and NetSmart are all planning to go live with 360X in the ambulatory world this year.
Dr. Miller, are you saying ECW tested 360X at this year's IHE Connectathon?
Yes, and in fact, I know there's someone on from ECW that can speak to that.
Huh.
So.
Interesting, because I was the monitor who did the testing, filled out the test reports, and I didn't fill out any test reports for them. So maybe I have missed. I don't know. Maybe I'm confused. I'll go back and check my notes.
Good.
Thank you. But this just goes to how slow the change happens. I feel like 360X has been demonstrated for a lot of years at the HIMSS Showcase. And I would think with this many years of attention on it, that there would be more uptake. And this is what we're trying to get to with trying to bring groups together, is to say, how can we take all this energy and make it have more effective change so that out in the real world.
I completely agree, Lisa. I think that's another reason, though, why we should not start constraining it. It's out into the field, people are using it, and then we can relook at, because you were suggesting constraints, and I think it's too early for that. I think perfect is the enemy of good right now. Let's get these on board and implementing with their clients.
Great. Okay. Well, I'll try and I'll touch base with you to find out how to get connected with that HIMSS work, and maybe there's work that can be reused and re-leveraged like that too. But when we do these IATs year over year now, we have the opportunity to measure our own progress. And we have visibility like folks like Dee Dee Davis and John DeMoore, who are in a position of telling us about the character and nature of the CDA documents that are flowing around in the wild. And right now, we're not seeing a lot of document types other than CCD. So if we're trying to push to have more encounter summaries and bend the needle, actually have measurable improvement on the ability to exchange information in other document types, we need to figure out what do we need to do all in a bunch of places to get more of these other document types like referral notes and consult notes and these encounter summaries flowing. I'm just trying to figure out how we can do something so that a year from now, if we get back together and we're talking about this, we can say, hey, we've got measurable change.
Well, I if I knew more document types to be asking people for, I could be saying to the hundreds of connections that we're working with, how come I'm only getting a CDA from you? What else can I get?
Yep.
So, maybe each of the EMRs needs to provide a status on where they are in terms of what they can produce. And that needs to be publicized in a way, certainly Chic could share that with its member HIEs. And maybe we could stimulate greater interest in the practices and facilities taking advantage of what their EMRs can produce. They may not realize that they can push them out.
Yep.
And
almost
isn't
like
the
a
Connectathon
Fire
a
has
great
this
venue for that?
capability. Connectathon?
Yeah.
I think, and Matt, what is it that IHE, don't you have some sort of like statement that you put out as a result of participating in the Connectathon, your IHE capability statement? That's
I think
something
so.
that, yeah.
Like, I don't know what happens with the tests after, they all get certified or whatever, but I was under the impression that sort of one of the points of the Connectathon was after everyone goes and exchanges stuff, then you have afterwards a digest of, here are all the different things that vendors are able to send and receive with one another.
Yeah, but how widely distributed is that digest, Matt? With
the Connectathon results are made public. I'll make a link in the chat in just a minute. So all international Connectathons held worldwide always have all Connectathon results published, but they are specific to IHE profiles. So it's probably going to be showing something like XDR for the direct message transport, for instance, things like that. So you're going to have like a translator. As a user, you may not understand it exactly, but that's where the vendors like an Epic or an ECW or whoever can create what they call an integration statement. And I'll put a link to that in just a second as well, as soon as I finish talking. But the integration statements are where they can actually say in human speak what it means that they did when they tested.
I'm pretty sensitive about direct on and XDR right at the moment, having just helped to expose a bug about which Direct Trust issued a national alert on Monday. But so you hit a real a real sensitive spot for me there, Dee Dee.
Sorry.
It's all right. It's life and technology. There are mistakes. But I just think greater communication. I think it's really easy to overestimate how many people are reading about Connectathons. So I'm just suggesting some other ways maybe to get that out there. And I think that Chic might be a valuable tool for communicating out, at least to the HIE community, which might then bubble up to the places that the HIEs are connecting with.
The first link that I put out there is the Connectathon results database that you can actually search. So that's the first link, and I'll put the integration statements out in just a second.
Great. I'm capturing those. Thank you.
And Nance, I took that as a note too, as something that we could follow up on to understand better what kind of a, Fire has a capability statement that has to be publicly accessible from every endpoint. And if CDA had something similar, something like I'll look at the document that Matt's talking about that comes as a capability statement from IHE, but maybe the CDA management group could come up with some sort of a CDA capability statement that EHRs could issue that would report what different document types that they are supporting and that folks could be counting on them to produce. Good suggestion. Thank you.
Sure.
I mean, everyone would just love to see more Connectathon participation from other vendors in the first place. So we can hype the Connectathon and all the better. I do have to
issue an errata. Dr. Miller is 100% right. It is not Meditech. It was ECW. So the 3 vendors who participated were ECW, NextGen, and Epic. So I'll fix that slide. And Dr. Miller, thank you very much for providing that information.
NextGen, not NetSmart.
ECW, NextGen, and Epic
are implementing
the one
360.
Are implementing 360X, not Meditech. That was the I wrote Meditech, and it should have been ECW.
Right. I had heard NetSmart. I'll give you another follow-up.
Sorry, NetSmart is actually able to be live with 360X currently. They are running a pilot with ECW this year, and Epic will be coming live with 360X this year.
Okay, that's great. We have quite a few connections with NetSmart, and it really it segues into the comment I was going to make, as long as we've got a little extra time here, which is that I think that two areas of expansion. One of them is just behavioral health, which is what NetSmart brings to mind, and providers of behavioral health services becoming more and more integrated and their needs being more front and center to the healthcare community. I've been dreaming for 15 years about integrating physical and mental health, and it's really still more of a dream than a reality. And the other, especially with the little bit of talking that we've done today about social determinants of health, is the whole question of integrating with the systems that one finds in the care management agencies and the agencies that are providing more socially oriented services that are obviously critical to healthcare outcomes. And I think especially, I think that the documents and the being able to handle different kinds of documents becomes really critical. And a lot of those people are using completely different systems. They don't think about themselves being CDA users. They don't think about themselves being FHIR users, but that's an area we really need to move into, because that integration is really what's going to change the delivery of healthcare in America.
And for what it's worth, I'll just, I think we've shared this before because I think Joe Lammy's presented it and we've mentioned it on another Implementation-A-Thon but there are some new people here. We also have to wait for industry. So for instance, we've mentioned the joint document content work group that Care Quality and Commonwealth formed. They actually published a version 1.0 implementation guidance document to improve content that they exchanged among each other. That was never formally adopted in a governance process where anybody was required to do it. Then they published a release 1.1 version with some additions and updates that I think Brett Marquardt had provided some input to and helped improve. And again, they never adopted it formally. And now they have just published, as of last year, they put a version 2.0 together, and Care Quality and Commonwealth are finally incorporating it into their governance, by which every member of each organization shall have to adopt it by a certain timeline. Those timelines are still being finalized, but it's one of those things that unfortunately all this guidance is out there, but nobody's held each other accountable to actually adopt it yet. So I think the comment that somebody made a little while ago, about not letting, perfect be the enemy of good enough. Let's not constrain it too much further, but let's push people to adopt it, and let's use these levers where appropriate. I know I keep hounding Care Quality, and they will be incorporating a testing program sometime later this year, and will be holding each other more accountable. Commonweal will be doing the same thing, I believe, for their members. I can't speak authoritatively about them. But I think that that's what we need to do is that, and as well as leveraging users like you, like Nance and others, to start asking for it, and whatever we can do to help you guys, help roll it out from your perspective will be useful for everybody down the
Yeah,
street.
I think so.
Lisa, this is Jim. I just got a comment because I come from all of this from a completely different perspective. In eye care, we have a lot of small EHRs, and just because they're small doesn't mean that they're not quality. One of the highest rated optometry EHRs only has 3.5 developers. They've got 3 full-time and 1 part-time developer, and they're one of the highest rated usability EHRs in eye care. But you can just imagine how swamped those guys are. And what they really want to do is be able to emphasize usability and, really working for their people that pay for their application. And what overwhelms them is outside obligations and other things that they have to meet that makes it very difficult for them, right? So one of the suggestions I would make, like during this program, I was getting emails from an optometrist that's trying to communicate with an ophthalmologist practice, and they sent C-CDAs back and forth, and it failed. So the problem is both of them are talking to the providers. The 2 EHRs are both saying we want to make this work, but they have no idea how to contact the other EHR and be able to have a discussion. So is something as simple as sort of facilitating something that says, hey, if you're trying to communicate with another EHR, or an issue, this is how you can do it. That's a block in the real world for these small EHRs that aren't participating in all of these things. Does that make sense?
Are they using direct, Jim? That in that example, were they using direct to share the files with each other?
Yeah, and the specifics, and again, now we're outside my technical ability, right? I mean, you're talking about somebody that learned how to type on a Royal typewriter. But the comment I got, they were asking me, is the receiving end said we're getting an XDM file instead of a CDA file, and we can't handle that. So, the provider's in the middle of that, and he doesn't know what to do to resolve it. So,
but if they both joined their HIE would probably handle that translation for them.
It's interesting. I've been on the phone with HIEs 4 times this week, and the HIEs can only deal with them if they have an integration. And the small EHRs, one EHR, well, there's about 70 different HIEs, right? They end up having to do all these separate integrations. You can't do one integration that links you to all 70, right? So when it comes to a small EHR, one of them has a list of 250 integrations that they've been asked to do. So they're overwhelmed by these integrations.
But I'll just reinforce this, Jim.
Yeah, but the HIEs can't support direct messaging right now.
Yes, they do. In New York State, we're required to, even though 30% of direct messages never get delivered. You're good.
Oh, that's great, though. That's good to know.
But we are required to offer direct messaging, which I happen to think is a suspect protocol. But what I'm trying to suggest is that for a small EMR, and I don't know the names of the ones in optometry, and I don't have a lot of experience with them, but for a small EMR, working through the HIEs offers them a more efficient way to communicate with all the other EMRs, because let the HIEs do it. And where the local HIEs are not offering that kind of service of facilitating communication between providers, push the HIEs to do it, because we do it in New York, and some of us do anyway, and we should be doing it. It's a key role that the HIEs can play, I believe.
And I would agree with you completely. We should bring this offline, and I'd love to have.
Yeah, I made a note of your name. I made a note of your name, sir.
You'll have to listen to Nance and me debate about direct later, but the direct group, Direct Trust, as a community, they also offer an EHR roundtable. And so one of the things that we're trying to do is to identify the many different places that there are communities that are working on problems, and then figure out what's the right way to get through to the most people that we can. IAT Connectathon obviously is one of them. Chic, the organization that is about HIEs, Sequoia, Direct Trust. We're trying to reach out to all these different groups to say, how can we use all of our efforts to solve this problem together?
Lisa's going to turn me into a convert. And the next time you all see me, I'm going to be yay, yay, direct.
Yeah, well, one of the things that I always recommend and what I'm doing with optometrists and ophthalmologists is one of the first things I recommend is get in touch with your HIE. But I'll be honest with you, out of all of those contacts, I don't know of any HIE anywhere that we've attempted to do it with that we've actually been able to make a connection through direct messaging. There's always
I would feel good. I would feel like it was a good outcome of today, Jim, if somehow or another we can fix that.
That'd be great.
Yep. So I have a follow-up question, which is are the attendees of today going to be published with their contact information so that those of us who feel like we've made new friends today can follow up on those connections? I hope so.
Yep, I can do that.
Yep.
Thanks, David.
That doesn't mean I want to see a whole bunch of spam emails from you, Nance. Like, come on.
No. I don't write spam. I don't write spam emails. I promise.
Use that power.
And the other thing that we should promote, you see up on the screen there, is if you don't have an account yet on Zulip, HL7 has a chat environment for the communities to message each other and to talk about problems, post questions, stay connected. And there is a CDA stream and a C-CDA stream. And we encourage everyone, there's already some chats out there about today. We'll be following up and adding some more topics so that these conversations can continue to grow. And it's a place where you can find each other besides the email. If Dave's going to share that, you can find each other in Zulip, and you can carry on conversations there. And then it benefits the whole community when we keep these discussions going in an open way. Everybody keeps informed.
Yeah, I would echo that. I think, one of the things we've always talked about, especially at the early IATs, is how to keep the impetus we get from here, the great work that we do and the meeting up of people. How do we get that to continue between IATs? And to me, using the Zulip chat platform is a way. And that way, for as an example, Lisa, you asked a question a couple weeks ago. If we knew everybody, all of the implementers and everyone was on there, and it's free and cheap and easy to join, then we would know that those questions and those, anything that we ask are going to get to a lot of people. And eventually, you've got a whole bunch, you've got 100, 200 people involved in CDA and C-CDA implementations in those chats. And now you can ask questions and get feedback, and it just helps. This camaraderie that we build up at these IATs can continue in the chat. So please go to chat.fi.org, sign up and join those streams. I like the quote that Natasha put here, right? None of us is as smart as all of us, right? So we can all benefit from each other's experience.
Absolutely.
All right. So that's all we've got. We're gonna end this a little early, so I'll give you guys 45 minutes back, I think, or 15. I can't remember exactly. Yeah, we're supposed to end at 4 my time, so 45 minutes back of your day. I want to thank you all for attending. Matt Ron had to leave early. He wanted to thank everyone for the participation, so I thanked him for us for his coming and doing his Ask the ONC session like he does. These IATs are nothing without your participation. So please, come back in July, fill out the event survey, and kudos to all of you who presented today. Those were some great presentations that I saw. So thank you very much.
Can you promise us yodeling in July?